Good day, viewers at home. You're welcome once again to another episode of Health in Focus. There's a saying that health is wealth, and truly, health is wealth, and not the gold and silvers that we have. So my name is Akinlabi Toluwalashe, and today we'll be talking about, last week we talked about arthritis, and today we'll be talking about innovations in the treatment of arthritis. And I have the same doctor that discussed arthritis last week, Dr. Ome Celestine. He's our pain specialist. You're welcome once again, Doctor.
Thank you, Tolu. Thank you for having me.
And thank you for being on our program for this episode.
No problem.
Thank you so much.
You're
really
welcome.
appreciate that.
You're welcome.
All right, Doctor, last week we talked about arthritis, and people are really looking into, okay, if you have it, what are the treatments and all that.
Exactly.
And today we are talking about innovations in the treatment of arthritis.
Yes.
So before you talk about the innovations, tell us about the normal treatments that the common man usually use for normal for arthritis before we go into the innovations. So what are the common treatments?
Great. Thank you, Tolu, for inviting me again to your program.
So sorry, doctor.
Yes.
Doctor. Before we talk about the treatment, for the benefit of those that didn't watch last episode, let's tell us what arthritis is before we talk about the treatment.
That's actually where I wanted to start, because you need to know what the problem is before you talk about the solution. Yes. Now, arthritis, just as I explained last time, is a combined word from arthros, which has to do with joint, and itis, which has to do with inflammation. So arthritis was defined as inflammation of the joint. That definition later on came with a lot of inadequacies. Inadequacies in terms of treatment or approach to solving arthritis problem. Because if arthritis is inflammation of the joint, your approach to treatment is to treat the inflammation, hoping that when the inflammation is taken care of, the joint pain will stop. But arthritis is not actually only inflammation of the joint. Arthritis is actually a disease that has two components: inflammation and degeneration. And two of them are in vicious cycle, just as you can see in this diagram. Now, at early stages of arthritis, inflammation is the major disease component, causing pain. With the chemical reactions triggered by that inflammation, there is eating and destruction of the tissues of the joint with other chemicals like interleukin, metalloprotein, proteinases, and all that. So when they are released, they begin to attack the ligaments, the cartilages, the tendons, everything that's around the joint, causing their progressive damage. Now, if you are taking medications like painkiller, what we call the anti-inflammatory drugs, you understand? The anti-inflammatory drugs, what they do is they simply go to reduce the inflammation. If you are reducing the inflammation, you are simply treating one aspect of the disease. But because degeneration has already started, it will be, as I said, there's a vicious cycle between degeneration and inflammation. So the degeneration will be causing more inflammation, and you are treating inflammation. You understand? Now, as the disease progresses, degeneration becomes a bigger disease. So at early stages of arthritis, you can see inflammation is the bigger one, then degeneration is small. This inflammation can be treated with the painkiller, resting the joint, exercise, warm and cold. These are the things people do, hoping to solve the problem of arthritis. So when people come to us in the clinic, you see them come with bags of drug. Doctor has been taking this, it didn't work. My doctor has increased it to this. My doctor in abroad has sent me this. My son in Enugu, you understand? So bags of drug, and still the pain persisted. Why? Because that degeneration has increased to become the predominant disease component. So that's what you see at the later stages of arthritis. Now, unfortunately, at the early stages of arthritis, when you take those medications, you feel fine. You can feel fine for days, for weeks, or even for months. But when the pain comes up again and you treat and you feel the same way, and it keeps on coming up again, just as I said last week, that is the point you need to investigate to find out whether degeneration has started. If you don't do that and continue to use the same method of treatment, the degeneration will be getting worse. So at later stages of arthritis, you see that degeneration is a major problem. That's when you take all those drugs, they don't work. So you see people telling you that the painkiller are no longer helping me, I can no longer walk and all those kind of things. It's because the focus of the treatment is now the smaller component of the illness, while the major component of the illness is not touched at all.
Okay, so that means the drug is not touching.
It's not touching the degeneration, exactly.
Oh.
And there's no drug you take by mouth that will heal the degeneration.
No drug.
No drug at all. Even if you are taking supplements, they don't on their own heal the degeneration. So if you are having pain and you are taking treatment in which you are drinking medication, whatever medication it is, you are not doing the right thing, because that arthritis will most likely not stop. You understand? The reason is because there is a degeneration and drugs don't help with degeneration. So that's where the innovative treatment in arthritis comes in these days. Okay? So when that innovative treatment, what are they? Is actually, just as I said, the disease in arthritis is degeneration. The treatment should be regeneration. Regeneration means to repair, to rebuild, you understand, to restore. So if the cartilage has worn off or the ligaments has been eaten into and all that, so you need to regenerate them, to restore them back to normal again, as if to say nothing happened. The headache, treatment of arthritis has actually been a headache to medical world for a long time. In fact, by the time you read many literatures, they will tell you arthritis has no cure. Many people watching us would also bear witness that their doctor has told them that you just have to manage. There's nothing you can do. You just have to live with it. Just continue taking your medications. And as stubborn as arthritis or as dangerous as it is a disease in which the drug you are taking is also causing you a disease. What do I mean? Yeah, the major medications people take for arthritis is painkiller, what we call the anti-inflammatory drugs. And the side effect of anti-inflammatory drugs is ulcer, stomach ulcer. At a point, they can affect the kidney, it can affect the heart. So I have an illness, and the drug I'm using to take care of the illness is causing me more problem. Some people have even developed bleeding ulcer and all that because of taking high dose of painkiller. Some people have been on painkiller for 3 years, 4 years, 5 years. So majority of people who have been taking painkiller for a long time, majority of them have ulcer. So they now are taking treatment for ulcer and all those kind of things. So that's where it is a dilemma. And that's what made many of us to begin to research. Is there anything that can be done, so that people will no longer be living on painkiller, which will even kill them. Arthritis does not kill. It might make life miserable, but the medications you are taking might kill. Yeah, it might even kill. Yeah, if it affects the kidney, it's a big problem. If it affects the heart, it's a big problem. If it causes a perforative ulcer in the stomach, it's also a problem because the person can bleed heavily. Okay, so that's that. We thank God for medical world. People have entered into research and have developed what is called regenerative therapy. So regenerative therapy is the umbrella name of all these treatment models, which include PRP. PRP stands for platelet-rich plasma. You understand? You have what is called prolozone therapy. You have what's called cold laser. You also have what is called human stem cell therapy. So these are.
I think they're showing on the screen.
They're showing on the screen,
okay,
exactly.
As you're mentioning, can you just?
Okay, so now this is the PRP.
Okay.
So PRP, this is the PRP here. PRP stands for platelet-rich plasma. Plasma, this is a treatment that you can see, this is blood. So is taken from the patient's blood. So when the patient comes for treatment, what is done is that you collect the patient's blood, put it in this tube, and put it in a centrifuge machine and spin it. So the blood will segregate or sediment like this. You don't need the red blood cell, which this is the red blood cell. Now this is the plasma. The plasma is the liquid. That yellow one you're seeing there is the plasma. You understand? So plasma is the liquid part of the blood. So you don't need the. So you now collect this plasma. Inside this plasma, you have other cell components that's white blood cell and platelet. So these are the three cells in the blood. Red blood cell, which is what you're seeing here. The white blood cell, because it's so few that naked eye can most times will not see it, or else you sediment it aggressively. Then you have platelet, which is even fewer than white blood cell. So because they are few, they hang inside this liquid part. So you now discard this, and this one as well, you now subject it to another spinning to be able to remove more of white blood cell. You don't need the white blood cell. What you need is the platelet. So when you spin it again, what we call hard spinning, the white blood cell and the platelet will sediment at the bottom. Okay. You now pick the platelet with the plasma. So that's why it's called platelet-rich plasma, which means plasma that is rich in platelet. Okay. So why platelets contain what is called growth factors. There are plenty of growth factors, platelet-derived growth factor, tissue growth factor, insulin-like. There are many of them. Very active growth factors. So as their name goes, they are chemicals that grow, or they are elements that grow tissues. They grow the tissue. So when you inject the platelet inside the affected joint, it will burst open and release all those growth factors, and each of them will begin to act at the designated area they are assigned to do their work. So before you know it, the cartilage will regrow, the damaged ligament will regrow, the joint capsule will regrow, the synovial membrane, everything, tissue in the joint will grow, and with that you restore the joint back to normal. You understand? Okay? So people also do what is called prolozone. Prolozone is where you have a mixture of medical grade oxygen and ozone. Okay. You understand? Ozone is, those who understand chemistry, oxygen is O2, ozone is O3. You understand? So if you pass oxygen, you can see this tube passing oxygen into the ozone generating machine, it will now bring a mixture of ozone and oxygen back to your syringe, which is what this person is collecting. Okay. So when you inject it in the joint, the ozone, which is O3, will turn back to O2. So that process releases energy. That energy helps to build what is called ATP. Sorry, we are going deep into science.
I'm also trying to understand it. Okay,
so, but just understand that ATP, adenosine triphosphate, is energy currency of the body. Okay. Why is it important? Why it's important is because any part of the body or any tissue that is dying is losing energy. Oh. If you eat, you have energy and you're strong. Mm-hmm. If you don't eat or you have malaria, you're not eating, you're becoming weak, isn't it? Mm-hmm. So when somebody is not eating, you like the person to eat, or the person will die. So also it's in the cells. So, and that's whenever we eat, at the end of the day, individual cells in our body has to eat. So even if we eat a bar, they eat by means of ATP. So what we eat will be digested down to the level that it becomes ATP, and that's how the cells will be rejuvenating. Okay, so what this does is because the cells are dying, that's where the wear and tear comes in. So when you inject the prolozone, that exchange of energy will help in the formation of ATP. So imagine a cell that had like 2 ATP, and you help the cell to have up to 30 ATP or more. Okay, the cell will begin to rejuvenate and live. Exactly. Okay, so this is called laser, which uses a laser light. A laser light is a light, when it's emitted, it has capacity to penetrate deep into the cell. So it's as opposed to what we call hot laser. There are 2 types of laser. Hot laser is the one used to do surgery. That one can cut, can damage tissue. But this is called laser, which helps to regenerate tissue. So what this one does is that it enters into the cell, and they help to knock off. Another theory is this. A cell that's dying because there's no oxygen, if you have a way to go into that cell, where oxygen was supposed to stay, because there's no oxygen, it is now being occupied by what is called nitric oxide, which is another oxygen that that kills the cell. You understand?
Okay.
It's also just understanding that it's an oxygen is a gas that kills the cell. So when you use this cold laser, when the light enters there, it knocks off those nitric oxide. It displaces them because they are not meant to be there in the first place. So when it displaces them, luckily you have injected this oxygen, so it will now find its way back to where it's supposed to be. That's how that ATP is. So it enhances the formation of that ATP. So another one I mentioned, which is not in this slide, is the human stem cell therapy.
Okay, before you talk about the human stem therapy, do you mean these three therapy, the three methods will be used for one person, or are you using just one method?
Okay, fine. Yeah.
Is it a combination of
the
three?
Like each doctor or each prolotherapist has his own method. Like me, I like to use the combination of the three because they work synergistically to encourage fast healing. You understand? Just as I mentioned, you can see this one gives you the growth factor. This one gives you the oxygen and the ozone. This one helps to knock off the nitric oxide. So every one of them, they combine together and work as a team. You understand? So some people do only this, but depending on the stage at which the patient comes, just as I said, people usually present to the hospital at late stage. When somebody I had a woman that, she was coming back from work and fell from, the Okada had an accident, you understand, and fell, and the car climbed onto her feet, which was, so she presented like the next day, and we used only this. So by the time she did about 3-4 sessions, she was fine. You understand? So it depends at the stage at which the person comes. So even combination of these three, if you come at a very late stage, it will not even solve the problem.
So it's advisable
to come early. Exactly. Because arthritis is graded from stage 0 to stage 4. So at early stage, you are having pain, you go to X-ray, X-ray comes out and tells you, everything is normal. But I'm having pain. At that point, you're at stage 0. Why X-ray says it's normal is because the degeneration has not gotten into the cartilage and the bone. It's still at the ligament. So don't be deceived when the X-ray says everything is fine, but you're having pain. So it means that something is causing the pain. So if you come at that early stage and you use this treatment, you stand up to 75% chance of permanent cure. Yeah, it is even higher than that sometimes. Okay, so a combination of the three gives better results. Sometimes some people use only prolotherapy, some people use only prolozone, but I like to use the combination of the three.
You just mentioned about stages. You just talked about stages.
Stages, yes.
Before you continue, before you tell us about the remaining innovations, can you tell us the stages? Let me know the stages.
Okay, yeah. So just as I said, arthritis goes from stage 0 to stage 4. And what I would like you to underline is, just as I mentioned earlier, arthritis is degeneration.
Yes.
So it's that degeneration that we are talking about when we talk about stage 0 to stage 4. We are not talking about inflammation, because the truth everybody needs to know is arthritis is not just inflammation. Arthritis is more of degeneration. So at early stages, just as we showed in the previous slide, at early stages, you might have more of inflammation. So if I go to do X-ray at this stage where inflammation is the major illness, the X-ray will come out and tell me that everything is fine because it did not see degeneration. So if one doesn't know, one might go home and think that everything is fine because there's no degeneration. No, degeneration is so small that arthritis could not pick it because, X-ray could not pick it because X-ray can only see the bone and have a gaze of where the cartilage or how much the cartilage is remaining. It doesn't see the ligaments and other things, or else they're swollen up and all that. Okay? So at that time, what the person is just having pain that when he or she takes painkiller, he feels fine. When he uses warm water or cold water, the person does all these palliative things will do, or you rest the joint, you feel fine. Okay. But when the thing now continues, it now enters into stage 1. So at stage 1, degeneration begins to appear bit by bit. So if you do X-ray at that stage 1, the joint space is still wide enough, everything looks normal, but the bone begins to show that there's something happening there. You think you have small bone, what we call bone spurs. You understand? At stage 2, the bone spurs becomes more prominent, and the joint space begins to reduce more, a little bit. At stage 3, the joint space is almost 50% reduced. You understand? So there's what we call joint space. By the time you do X-ray, there's a gap between the bone of the thigh and the bone of the lower leg. You know, that is the gap that we're talking about, and that gap represents the thickness of the cartilage. So when the cartilage is wearing down, the gap begins to narrow. So by stage 4, the bone is jamming each other. So at the late stage 3 to stage 4, the person will tell you that if he or she walks, will be hearing noise, or there will be a crack in the joint, especially the knee. You know, they'll be making noise and all those kind of things. The bone is already rubbing on each other. You understand? So now to restore those worn-off cartilages, that's where regenerative therapy comes in. So that's what is mentioned here: prolotherapy, PRP, prednisone, cold laser, and human stem cell.
That's what you want to talk about.
That's what I wanted to talk about. Okay. So human stem cell, as opposed to, there's a supplement they sell around. You know, people sell around. That's also called stem cell. Okay. That one is from plants. That one was designed from plants. Is as good as supplements. It's not as potent as human stem cell. So human stem cell is harvested from the person's, not from another person, from the person's own bone marrow. You understand? It's harvested from the person's own bone marrow, or from the fat at the stomach wall. You know, there's a way to harvest the fat cells there. So you prepare it, spin it, and inject it just as you prepare it as you prepare PRP, and inject. You know, majority of us don't do this because it's invasive. We have to pierce through the bone and all that. So it's more like mini surgery, you know, which is, you know, and it's expensive. Okay, so in terms of potency, yeah, it's in terms of classification, it's more like the more potent regenerative therapy, followed by PRP. You know, some people combine both human stem cell and PRP. So, but we do PRP, prednisone. We don't go into this invasive one. Even this human stem cell is used for people that have stroke. There are some centers that use it to heal the brain, or heal the pancreas and all that for people that have diabetes. So that's the new innovative treatments. That's where the science is going now. Okay.
Okay. So the human stem cell injection and the other, which one is more effective? Which one can cure more effectively?
Much faster. Actually, there's a controversy between PRP and human stem cell. You understand? Because what PRP does, just as I mentioned earlier, and it contains growth factors. One of the things it does is also to initiate production of human stem cell wherever it is injected. So even if you don't go picking human stem cell, the PRP injected will also invite the human stem cells in the joint where you injected it. So why should I now go? I mean, that's a different school of thought. You know, some people said to get better results, it's better I combine human stem cell and PRP. But by science grading, you could say that human stem cell is a bit higher in terms of sophistication compared to PRP and should work faster. But, you know, it all depends on what the patient wants and what the patient can afford.
Okay. So with the regenerative therapy,
yes,
are you assuring a patient that 100% the arthritis will cure it permanently?
Let me put it this way. Actually, in life, I mean, doctors, we're always very careful in how we choose our words, you know, in as much as you can be almost 100% sure. So we can't say there's no treatment that's 100% effective all the time. But all the time. Mm-hmm. But what we're looking at is how, in terms of average, what is the effectiveness of this treatment. So when you're having possibility of 75% and even more possibility of permanent cure, that is actually very high. That's actually very high. So we might not tell the patient, even if the patient comes at any stage, you might not tell the patient that 100%, in as much as it's not at the back of your mind that it could be. But there are other things that you might not be able to, that's not within your control, that might not allow or assure that 100%. So it's difficult to say this patient 100%. But what we always say is, the earlier you present, the higher the likelihood of your permanent cure.
Okay.
You understand? So it all depends. The earlier you present, the higher the possibility of permanent cure. Exactly. So if one can present at stage 0, stage 1, you know, from 75% upwards, in that case, you also have to put into consideration the person's age, body physiology and the other ability to go through the treatment and cooperate with your instructions. And also, that's what I said, there are certain things that might not be under your control. In as much as you know that if everything is followed in the normal way, this is the kind of result you might get. Oh. Okay?
All right. Thank you very much, Doctor, for taking us through this thing.
You're
your wealth of experience. Thank you.
You're welcome.
For teaching us, telling us about arthritis.
You're
really
welcome.
Appreciate that.
You're welcome.
All right, viewers at home, I hope you've learned as I have learned. I don't really know much about arthritis until now. So my advice is anytime you notice any prolonged pain in your joints, try to go to specialist hospital. Doctor said it's not being treated in just any hospital. So just try to go to specialist hospital, get a test done, and try to know if it's still inflammation or degeneration, so that you know the route to go concerning the treatment. This is how far we can go on today's program. Don't forget to watch another episode next week, same time, same station. I'm still Akinlabi Toluwalashe. Bye for now.